Hello, very good morning to all of you. Today we have a very privileged Abhishek Kumar, a leading ophthalmologist from AIMS. So today we are talking about a digital device. In today's world, digital device have become an inspirational part of our daily life. Whatever for work, education, entertainment, or a communication. However, with the constant exposure to digital screen come our growing concern to dry eyes. So, who will help us to understand? So today, Abhishek sir will understand us. So, how to manage eye health while using digital device? So, doctor, please tell us viewers about digital device.
Okay, so thank you for this night's introduction. I'm Dr. Abhishek Omkar from AIMS Deoghar. So regarding in today's era, digital devices. So the problem because of digital devices have like surpassed anything. It's called as a silent epidemic in nowadays times because everyone is on devices for more than 4 to 6 hours on a daily basis. And what it has caused is mainly the dry eye part, which has been like accentuated manyfold. And especially post COVID, we are seeing that like almost in every children and even in adults, obviously.
Okay, shall I start another question?
Sure.
Okay. How does prolonged screen time contribute for a dry eye disease?
So, like with prolonged screen time, what happens is you forget to blink. So that is the main thing. So the reduced blink rate. So usually we blink for 14 to 15 times per minute. And what we have documented in even our studies also that the blink rate reduces to less than five. Even sometimes it's one or two blinks per minute. So that is what mainly hampers the tear film circulation, leading to dry eye. Second thing is infrequent blinks. So infrequent blinks, incomplete blinks. So that is mainly accountable for the dryness caused by it.
Thank you. What are the common symptoms of dry eyes caused by the digital device users?
So mainly the patients complain of burning and itching sensation because they are not able to generate tear because of that prolonged non-blinking of eyes. They tend to stimulate by rubbing the eye. So the itching, dryness, and reflex watering is what they have, and irritation and burning sensation.
Okay. So, what are the preventive measures should be taken while taking on digital device?
So, as per the WHO recommendation, so it is recommended that in children, actually, the screen time less than 5 years, it should be 0 hours. And if we go to it, like they are having the screen tabs and mobiles all the time, so that is to be strictly adhered to. And even for adults, it's recommended not more than 2 hours of screen time on a daily basis. So, what we can now, this is by a part and parcel of our life, so we cannot obviate it, obviously. But yes, what we can do is we can have some ergonomic changes like whenever you're on screens, try to blink often. Okay, so put some stick notes near your workstation. Look at something far away, 20 feet or beyond, blink 20 times after every 20 minutes of near work. So that is one thing. Have good illumination of the room and brightness of the screen should be reduced. Pixel size should be good and the inclination of the screen should not be very high up. So that increases the dryness. So it should be at a 20-degree inclination. So that helps.
Okay. So, what are the effective treatment to manage dry eyes caused by digital screen exposure?
So one part, as I mentioned, is the ergonomic and what you can do on your part. But definitely, if it surpasses those things, then you have to resort to some medications also. Mainly, the lubricant teardrops help a lot, and I think the EcoTears from Intas has been doing a fantastic job in that part. So lubricating eye drops as per need that remain the mainstay, and if it aggravates further, then you can resort to even cyclosporins for the severe dry.
So, what are the prevent measures should be taken to while working on digital
So
screens?
that I think I already answered.
How does the prolonged screen time contribute to dry eyes?
So as I said, prolonged screen time. So there one thing is the reduced blink rate, infrequent blinks, and definitely if you are using it overnight. So what happens is the blue rays from the screen, so they hamper your sleep cycle also. So in that way, indirectly again, it is hampering with your tear circulation and production.
Okay. How much screen time per day considered excessive in terms of our eye health?
So as I said, as per WHO recommendations and also the recommendations for American Acad, it is like less than 2 hours per day. That is what is recommended. But yes, you can for your daily uses, you can just break it off into segments, and that would be helpful.
So how can we take care of our I
So, like for screen users, as I said, ergonomics, teardrops if it is like not being relieved by those measures, and some warm compression. And now, especially now that summer is on, what you can do is you should not be facing your AC directly. So it should be behind you, so that because if the AC vent flow is coming directly to your eyes, that aggravates dryness tremendously. So that is one thing that you can do. Do some warm compressions on a daily basis and stay. And yes, one very important thing is stay away from any kind of screen uses 2 hours before bedtime. So that is like essential.
Is there any advice to you give to your viewers?
Well, that is what I will say. That yes, being on screen is like a part and parcel of our daily life. Daily life, we cannot escape that. But what we can do to like enhance our productivity is we can take those measures, the ergonomic measures, and even resort to the lubricating eye drops. Definitely, they will help, and we can be more productive in our economic and social life. Thank you.
Thank you for the very good points. And people should know about the digital device. And thank you for sharing a very valuable and important for about digital device. Your expertise help us to understand the digital device, and it is we all know it is very harmful for using a screen time. So, to all know, we were reducing screen time, practice eye exercise, and schedule regularly eye checkup, especially if you are continue experience eye discomfort. And please be alert, be check, and go for a checkup on regular basis. Be safe. Thank you.